Well, speaking of which, do you do any robotic? I've been hearing all these because you see advertisements on TV for robotics versus, I don't know,
Yeah. I have dabbled with robotics, and we've dabbled with all kinds of different technologies as they've come onto the market. Because part of my engineering mind is I want to know
to see if it's better.
Is a patient-specific cutting guide better than a conventional cutting guide? Are handheld navigation systems or robotic surgeries better?
Right.
I've done a few robotic cases. I haven't done a lot, but I haven't found it to be all that useful in my practice.
I don't know too if it's the same for you guys, but for OBGYNs, for the GYN part of what we do, we also have robotics. But the robot is kind of volume dependent, so the better robotic surgeon you are depends on how much you actually do too, right? So it's kind of, and I'm an old school, I don't usually do robots, I don't do enough of them.
Yeah,
so I do just vaginal hysterectomy, abdominal hysterectomy, I don't do robotic. We send you to a specialist, you know, so I don't know if that's kind of...
I think it's probably the same is true with robotic surgeries. It's interesting if you look at the literature, robotic surgeries have not increased the patient-reported outcomes or increased the clinical outcomes for patients, except in the area of alignment.
Oh, okay.
And it makes sense, right?
Yep.
Because the robot can help make your cuts on your knee replacement.
They put the tire on.
The robot can put the tire on more consistently, or at least guide the surgeon to put the tire on in a more consistent alignment. Right?
Yeah.
But that hasn't equated to the car running any better. And again...
And the service is more expensive or no? To use technology?
To use technology is a little bit more expensive. I also would say that it is also more time consuming. So patients will be longer in the... This is on average. But like your point about the high volume robotic GYN surgeon.
Yes.
The high volume robotic surgeon that does a lot of cases are obviously more practiced and should be relatively efficient with that surgery. So I do know robotic surgeons, at least that's on the mainland, that are doing it in about as quick a time as they did it with just conventional instruments.
Wow.
But that also depends on who you're comparing it to, right?
Yeah, that's true.
So if you are a surgeon that, say, takes an average amount of time to do a knee replacement or a hip replacement, then if you do robotic surgery, probably your times are initially going to be quite a bit longer. And that's definitely true.
Yeah.
Right?
Yep. Do you see it going that way or not necessarily?
I don't think so. I think because it hasn't shown to really improve the overall running of the car.
Yeah, the outcome.
The outcomes.
Yeah.
Except for alignment. And because it's more expensive.
Yeah.
I think it's going to reach a certain, this is just my opinion. Maybe when robotics gets better, it will become more of a standard of care. But for orthopedics, at least in joint replacements, it's a super cool tool. And like I said, as an engineer, I look at it and I'm thinking, wow, this is cool.
Yeah.
Like it's neat, but it's like using a robot to pound in a nail. It doesn't help me much.
Right.
Especially if I can pound in the nail pretty well with just a regular hammer.
Plus that tactile sensation, I don't know if that's different too.
The other thing I think...
Because with us, when we're suturing with the robot, you kind of don't have that tactile sensation of how hard I'm pulling the suture or, that
but
kind of
as
thing.
robots get better...
They're getting better.
I'm going to say that it's going to get better probably in the future.
Yeah.
The other interesting thing that I always argue about with robotic surgery is that part of the reason why I don't think it has made clinically a difference, right, in terms of, like I said, making the car run better, is because we don't know what the targets are, right?
What do you mean?
The robot doesn't know where or how it should put in the knee replacement.
Oh, it's not like
in
AI.
Words,
it doesn't think for its...
Well, even then, right? Let's go back to the analogy of the car, right? If I'm the mechanic, and you bring me a Honda Civic.
Okay.
The Honda Civic has specifications from the design department.
Yeah.
Saying that, this tire needs to be this diameter, needs to be on this size rim. It needs to be, the bolts need to be tightened to this, pounds per square inch, blah, 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 or torque, right? It has specifications, but each human being has no manual.
True.
How do I know that your knee replacement should be done the same way as my knee replacement?
Yeah.
Or your knee replacement is going to be done the same as the 6'4" guy.
I see.
We don't know there's no manual that came with
So it doesn't take into account.
Well, how do we know in other words, what is our goal for that particular patient in putting in his knee replacement?
Right.
We don't know.
Yeah.
So we're still guessing on how am I supposed to put this tire on this particular car?
Yeah.
Because there's no specifications. There's no manual about what size tire, how should I put the alignment in, what rotation. Everybody's a little different, right? So the robot doesn't know that, and we don't know that as doctors.
Right.
So every time we do a surgery, it's really our best guess based on some parameters that we have figured out in surgery of, okay, this is generally what we want the knee replacement to be like, right? And the robot can do no better than that. It can maybe make your cuts, but you still don't know what the target is.
I see.
Right? So if I take a robot and I do your knee replacement, and you come back and you're unhappy with your knee replacement, I did the best I could based on what I knew was supposed to be for your knee. But really, in reality, you don't have a manual, so we had to guess what and how to put your knee replacement. I mean, like I said, we have some parameters. Yeah. But we don't have any specifics, right?
Interesting.
So, but I think in the future it'll get better, but we'll still be without the manual for each patient. So